Recently, we have been noticing a lot of Nipah virus infections in the society. So let's talk about Nipah virus. So Nipah virus is a zoonotic virus. That is a virus which spreads from animals to humans. So initially, it was noted in Kerala in 2021, where it was believed to be spreading from the fruit bats, or which are also called flying foxes. So this virus spreads whenever the fruit bats are stressed out. Because of the stress, the virus spreads from the bats to the humans. Once it spreads in the once it infects the human being, it goes and resides in the brain tissues, or what we call as encephalus. So it can lead to infection of the brain tissue called as encephalitis. The symptoms can present as late as 2 weeks after the infection has set in. So generally it is a reversible process, and it causes a lot of mortality, and fatality is too high in this virus. So it causes a severe headache, high grade fever, seizures, and as well as sometimes seizure which can lead to death, and also sometimes it can lead to irreversible brain damage. So that is the reason we need to see how to prevent the infection. Generally, to prevent the infection, infection is recently spreading from human to human by contact. Whenever one person comes in contact with the infected person, the body secretions can lead to spread of the infection, like the sweat, the saliva, or the blood. If in a healthy person touches these secretions, they can get infected with the virus, and the person remains infective even when he is not symptomatic. That is, the infection causes symptoms only after 5 to 14 days after infection set in. So till that time he is still infective. So we should be very careful. Once the person is detected to be suspected to be having Nipah virus, we should go for testing his body secretions for RT-PCR or antibody testing in the blood. So once it is detected, then we need to be very careful with handling of the secretions of the person. So second thing is, once overall contact of the person, we should also be kept under surveillance, and also they should be strictly monitored, and signs of encephalitis or high grade fever have to be treated. General treatment includes treatment of fever and symptomatic treatment. Generally, there is no antiviral available to treat this Nipah virus. That is why we need to take adequate precautions to prevent the spread of infection from person to person. And recently in Kerala, we have noticed Bangladesh variety of virus, which is highly virulent and spreading very fast. So whenever there is a suspected viral encephalitis in a person, we should go for testing, confirm the infection. Then once the infection is confirmed, we should try to quarantine the patient, and also the quarantine the people who have come in contact, and observe signs of infection and treat symptomatically, and hope for the best, because there is no general antiviral treatment available, and there is no definitive treatment available for this virus.